Hello and welcome to Office Hours, where I answer your questions about weight and weight medicine. I'm Dr. Meghan. I'm a board certified physician in internal medicine, lifestyle medicine, and obesity medicine. And this is really important because I actually talk to patients about their weight all the time. I actually prescribe these medications all the time. I've helped hundreds of patients lose weight, and I'm here to help you too. So if you're confused about your weight, if you have questions about weight medicines, and if you want medically based answers to your questions, you're in the right place. Welcome. So today I'm answering more of your fabulous questions. If you have a question afterwards, you can leave it on this video or another video and I will add it to the list. As a caveat, as always, I can't answer personal medical questions. So if you do have a question that's a little bit more personal, I'm going to change it a little bit so it's more broadly educationally relevant for everyone. So with that being said, let's get started. First question, this is about GLP-1s. Are the side effects dose dependent? That is a great question. Theoretically, yes. People can have more side effects as they go up, but I've really seen it clinically be all over the map. So I've seen patients have really bad side effects in the beginning, like, they feel really nauseous, they're vomiting, they have a lot of constipation. I've seen it be really bad in the initial phase and then kind of peter out. I've seen people have pretty constant side effects regardless of the dose that they're on. I've had people, be on different doses and have different amounts of side effects. So maybe like the 2.5 wasn't great, but the 5 was okay. And then they went up to the 7.5. Like it really depends on a lot of other factors too. It depends on what somebody's medical issues were prior to starting the medication, if they're on any other medications now, what they're eating, that can make a really big effect on the side effects. Like if somebody's eating like a lot of cheeseburgers or like heavy fatty foods. Now remember, these medications slow the movement of food through the stomach. So if you have something that's like really heavy and fatty, it's going to sit there for longer, like a brick. So be careful around that kind of food because it may make you feel worse. So the answer is it really depends on the patient. And some people may find they have more side effects as they go up, but for other people, their side effects just get better. So, and you don't really know until you try. I will say as a pattern that this class of medications tends to be quite unpredictable in terms of how people react. But anybody who has had, I would love to hear what your experiences are, especially if you are in that category of side effects were bad at first and then they got better. We would all love to hear about it. Next question. I have been on Zepbound for 15 milligrams for about 3 months, and I'm thinking my body is getting used to Zepbound. Should I stay on this dosage or go down? I've not lost weight in about 2 weeks. I was spacing it out, but I went back to the 7 days, still nothing. Okay, so this is a good question, and comes up for a lot of people. Once they get to that maintenance weight, what do they do? Do they go down? Do they stay where they are? Should they space things out? And I think there is always a little confusion in terms of like the medication's not working, but for most people, it is working. It's just not going to work past a certain point. It's going to get you to that, if it's tirzepatide, on average, it's a 15 to 20% weight loss. But for most people, it's not going to get them to like a 40% weight loss, right? So there is a point past which you're not really going to lose more weight unless you add something else, unless you make some lifestyle changes, unless you add another medication. So if somebody has noticed that they've been losing, and then they're on the 15, they've been losing, and then it starts to level out, it might just be that you are reaching your new normal on the medication, and that's just as far as that medication is going to get you. Now, if I have a patient who has reached that new normal, I keep them on that dose. I do not back off unless there's another reason to do so, like they're having a lot of side effects They just can't tolerate it, or they've, if somebody lost a lot more weight than we anticipated and we want to slow down that weight loss, then I will back off. But if somebody has been losing weight and the weight loss has kind of reached its new normal level, I am just going to keep them, for most people, at that 15 milligram dose. That's what the protocol is for now, and that's what the research has been tested on. I don't put people on a higher dose. I just keep them there. And then depending on what their goals are, where we feel like they are going to be healthiest, we might add something. We might work on lifestyle changes. There's a lot of other things you can do. But if they, and I'm always calculating what that total body weight loss is too. So I think that can be helpful for people as well. If you're noticing that weight loss is starting to level out a little bit, go back and calculate your total body weight loss. What is that percentage? And, if it's, 5%, 10%, maybe you're not getting as robust an effect as you would expect. You want to talk to your physician about that. But if you're close to that 20% weight loss, and again, of course, check with your physician, but this may just be where the medication is going to take you, and that's fine. That means it's working. It's working. It's just not going to work more than that, right? So I just keep people on that highest maintenance dose. And for most people, that's 15. Next question, can you define what constitutes heart disease when applying for coverage? And I'm going to answer this question with regards to the GLP-1. So sometimes some of the insurance companies will only approve it if people have, overweight or obesity and predisposing medical conditions. And a lot of times, so a lot of times, especially for things like Medicare, like they often won't approve Wegovy for weight unless somebody has significant cardiovascular disease history. And usually what that means is that they already had a history of heart attack, stroke, or peripheral vascular disease, which is when there's cholesterol buildup outside the heart, outside the brain, to a significant amount that it's causing symptoms, specialty referrals, those kinds of things. So that, unfortunately, some insurance companies want you to be sick before you get the medication. And I know that does not make any sense because we're trying to prevent people from having stroke and heart attack and peripheral vascular disease and that's the whole point of these medications. I'm not in charge of the insurance companies. I don't make those rules. But a lot of times when they are saying, asking for a prior significant cardiovascular history, that is what they mean. So, and it depends on the insurance. So for some people, it is not enough that they have overweight or obesity and high blood pressure or high cholesterol. They really want people to have more severe complications of that before they will consider approving it. So, and of course, that's always changing. So that's definitely like a moving target. But a lot of the times, if insurance is giving a lot of pushback, that's what they mean. Next question. I am on Wegovy and I'm almost done with month 4. Okay, I'm on 1 milligram and then moving to 1.7. I've lost about 16 pounds, but it has been really slow. I definitely had some weeks where I didn't lose anything. 1 week I gained and then I lost again. I'm trying to be patient with the process. And remember, I lost 25 pounds on my own before starting, but it's hard to see people that lost 30 pounds in just a few months. Okay. This is such a great thing to share. Thank you so much. First of all, I want to back up and congratulate you on losing 41 pounds. That's great. That's amazing. So we definitely don't want to gloss over that. That's a significant amount of weight, and congratulations on all of that. I think, like I said earlier, everybody's response to this medication is really different and it's all over the map. So I think it's really helpful for people, like if you're taking this medication, like just put the blinders on and focus as much as you can on your health, because yeah, there's always going to be somebody who like loses more weight on a lower dose. But like, so what? Good for them, right? Like, that's great. We wish it happened like that for everybody, but that happening for them doesn't need to take away from your success on the medication. Like, you can both lose weight and both enjoy a healthier life. So to compare is truly to despair in this circumstance. Just put the blinders on, and you also never know what is going on with somebody. So they might have lost more weight than you, and it might have been on a lower dose, but maybe they're just like nauseous around the clock and they really have to take a lot of over-the-counter medications, or they they're having a really hard time eating foods that they used to enjoy. Like maybe they used to enjoy certain vegetables and they really can't eat those anymore because they don't agree with them on these medications. So you just never know what else is going on for somebody. And so just put those blinders on, focus on what you can control, like eating, exercising, all that. You don't know what's going on with those other people. If they're losing weight, that's great. It doesn't take away from your success. And just try to focus on how to get to the healthiest version of you. But yes, congratulations on the 41 pounds so far. Good luck with your weight loss journey, and definitely keep us updated on how it goes. So that's going to do it for today. Thank you so much for watching. If you have questions afterwards, you can definitely leave them on this video. You can leave them on another video and I will find it and add it to the list. If you want to work with me directly, you definitely can. I do work with people around the world on the non-medical aspects of their weight loss as well. So I will leave all that info down below. Thank you so much for watching. If you're not subscribed already, subscribe, because this is the place for medically based answers to your weight questions. Thank you so much for watching, and please be well.